And I now call David Harding-Price from Lincoln, Sleaford and North Hykeham to speak 4 lines 19 to 22 and 28 to 29.
Good afternoon, Chairman. Thank you. Good afternoon, Conference. I'm actually going to speak from the heart because I didn't expect to get called and I've gone and left my speech in the hotel. But after 36 years as a nurse in the NHS, this isn't going to be a problem. We've seen the NHS struggle. Thanks to Labour, they wrecked it. The PFIs that have been tethered to our trusts are leading not only huge debts, what they've done is they've cut down the number of nurses, they've cut down the amount of equipment, we're relying on charities, and generally the staff out there are struggling. Trust me, they are. We have a situation in Stamford where they were going to close the hospital because of the PFI at Peterborough, because it's all one trust. We think it might have been saved now, we're not sure. For those of you that know Norwich Hospital, they could have paid for it with a mortgage at the rates that they used to be, owned the hospital some years ago. They've started to carry on paying and they still won't own their hospital at the end of it. The Health and Social Care Bill has not helped either. CCGs are focusing on care. It's well known that we're short of money, but all the PFIs are doing is taking the money out of healthcare and putting it in the pockets of the city. That's not what you and I pay our healthcare tax pounds for. We pay so there are nurses and doctors and physios and everybody else out there to care for us. Now, line 20 says that the motion says if. You look, but it's not if, it's when, because it's already happening. The situation is that, as I've said, we've got less nurses now than when Labour was in power. Now, they'll blame the Tories, they'll blame us. It's not our fault that the PFI money was put in place in the last Labour government, and it's not our fault that we can't simply write it off. So we really have got to look at this. It's not if, it's when. Also, of course, we've got to argue we're the only party that will actually protect the NHS. The Tories favour privatisation. They'll say they don't, but they do, because they're the ones who are pushing for the 49% cap on the hospitals. They're the ones who are making sure their friends in the city have the money, rather than the money go in the pockets of nurses and doctors and physios. Line 28 has to happen. Mr Hunt needs to grow some testicles. He needs to stand up to the companies who are making these obscene amounts of money out of taxpayers and say no. If he can't, then Norman, I'm sorry, you're going to have to do it for us. And we know you've got some testicles. As to line 29, it's not an option, it's a must-do. You really do have to look at how we make sure this happens, because we have the greatest health care service in the world. Everybody comes here. Last week, 2 nurses from Slovenia come and meet with me because of the health service in Britain. I'm going to ask you to vote for this motion in its whole, to protect your hospital and your services, to protect your NHS, the greatest in the world, but more importantly, to protect your health. Because without health, no wealth. And without wealth, the city PFIs won't get their money and we'll have a shed load of empty hospitals doing nothing. Thank you.